In this video, I'm going to share with you what nobody talks about when it comes to healthcare in early retirement. I've guided countless retirees through the confusion of healthcare in this early retirement period. And for many, it should be easier. It can be easier than it seems, which is why I put together this video where I'm going to run through different healthcare options all early retirees should consider before they walk out the door. So let's jump right into it after I share why this topic is so important to me. So here's the deal. I've met so many people over the years who want to retire, but feel like they can't because of healthcare costs. And I think I know why. See, most people have spent their careers working for companies where health insurance is provided by the employer, even if they're paying a bit more each year through their paycheck. So when they think about retirement, they panic at the idea of losing that employer-sponsored coverage. As someone who's been self-employed since 2007, I've learned that health insurance is just another expense to budget for. Yes, it certainly can be expensive, but it's like any other necessary purchase. The reason this comes up often in my role as a retirement planner is because many people stay stuck in jobs they no longer love or even like simply because they're worried about healthcare before they're eligible for Medicare. Not everyone, but enough to notice a pattern. The truth is, it's all just one big math problem. Either you have enough to cover your insurance or you don't. But we have to be careful. If you retire early, you have a long life in front of you. A woman who retires at 55 will have to make her savings last for 28.6 years on average, compared to 20 years if she retires at 65. A man who retires at 65 will have to stretch his savings for 25 years rather than 17.8 years. This all courtesy of the Society of Actuaries. So the money has to last a long time, and there's a lot at play here. So let's walk through some options so you can see that with the right plan, retirement could be closer than you think. I've identified 3 general ways to cover your healthcare costs if you retire before you're eligible for Medicare: COBRA, the Affordable Care Act, and private health insurance. Let's start with COBRA. COBRA, or as it's known in the trade, the Consolidated Omnibus Budget Reconciliation Act, is a law that allows employees and their families to maintain their employer-sponsored health insurance after leaving their job. With COBRA, you can continue the employee health insurance, but with a catch: you have to pay the full premium plus a 2% administration fee. This cost can be a shock since employers typically cover a significant portion of the premiums while you're employed. Take John, for example, who retired and suddenly saw his monthly health insurance costs skyrocket, as a common experience among retirees. According to the 2023 Kaiser Family Foundation Employer Health Benefits Survey, the average annual premium for employer-sponsored family health coverage jumped 7%, reaching $23,968. with employees contributing about $6,500 on average. So yes, COBRA can be pricey, but for retirees nearing Medicare eligibility, COBRA can be a practical, albeit temporary, solution to bridge the coverage gap until more affordable options become available. By the way, we can only cover this specific healthcare advice in a short amount of detail, but we will break down this topic more in an upcoming video later this week. So click subscribe to be sure not to miss out. Another common source for health insurance is the ACA, or the Affordable Care Act. This law passed in 2010, also known as Obamacare. The primary goal was to make health insurance more affordable and accessible. The ACA introduced several key provisions, including the 3 that I'm going to focus on in this video: subsidies, pre-existing conditions, and the overall marketplace. Let's hit the most important consideration first: pre-existing conditions. Health insurance companies can't deny coverage or charge more due to a pre-existing condition such as asthma, diabetes, or cancer, according to the Department of Health and Human Services. Once you're insured, your plan must cover treatments for these conditions without limiting benefits. Pre-existing conditions, once again, include any health issue you had before starting a new policy. It can be heart disease, it could be asthma, it could be high blood pressure, Even past treatments can sometimes classify you as having a pre-existing condition. So the reason this is so helpful at this stage of life is that without the Affordable Care Act, millions of Americans, like 82 million with employer-based coverage, would and could struggle to get affordable health insurance if they became self-employed or they changed jobs or faced life events like a divorce or retirement. This is especially risky for older adults because between 48 and 86% of people aged 55 to 64 have a pre-existing condition. Even if you're healthy now, a large portion of people are likely to develop a pre-existing condition within the next 8 years. Without the ACA, these conditions could limit your options for affordable health care. The best way to find a plan is through healthcare.gov, which has become a lot more user-friendly lately. One major improvement is the introduction of standardized plans that make comparisons more simple. Previously, there were like 100 plan options with different costs. It was overwhelming. Now, easy pricing plans offer consistent cost sharing across services. So you can focus on comparing premiums and provider networks, which really helps. With fewer non-standardized plans, it's easier to find the right fit. Now, marketplace plans are put into 4 categories or metal levels: bronze, silver, gold, and platinum. These categories have nothing to do with the quality of care you get in a plan. Generally, the difference between categories is based on the plan's share and your share of costs for all the covered services. If you qualify for extra savings based upon your income and enroll in a silver plan, as an example, the plan pays more and you pay less. So we need to learn about the extra savings. For example, as you can see on this chart, if you select a gold plan, it's going to pay for a higher percentage of your care. To receive that benefit, you'll pay a higher premium. That's sort of how it works. Healthcare.gov advises you to consider a few variables before choosing. Your total spending on healthcare is one, not just the premium, but your overall spending. And they suggest you review plans in different categories to see how the plan's share of cost can adjust the estimate for your total yearly costs. The other thing is quality of care, to compare each plan's quality with their quality rating, a star rating on a scale of 1 to 5. The name of a plan category has nothing to do with its quality of care. The last thing in the ACA I want to talk about is the premium tax credit, which is a subsidy. These subsidies are designed to help people afford health insurance before they reach the age of Medicare. Your eligibility for subsidies is based on your income in the year in which you're covered by your health plan. It can be a bit complicated, but let's give it a whirl. When you go on the healthcare marketplace, they're going to ask you a bunch of questions to help determine if and how you qualify. This chart shows the appropriate income levels. Here's an example that incorporates the data. The amount of tax credit is calculated by subtracting the individual's required contribution from the actual cost of the benchmark plan. So for this example, if the benchmark plan costs $6,000 annually, the required contribution for someone with an income of 150% of the federal poverty level is 0, resulting in a premium tax credit of $6,000. If that same person's income equals 250% of the federal poverty level, or $36,450 in 2024, the individual contribution is 4%. Let me share a real life example to illustrate this. One of my clients, a husband and wife, followed my advice and set aside the money they'd need for their first few years of retirement and certificates of deposit. I recommended this because it's never wise to take risks with money you need to pay your bills, especially essential bills. While the bulk of their savings were in 401ks, they didn't have to touch these funds in the early years of retirement prior to Medicare. With little reported income, they qualified for substantial tax credits. They had initially worried that healthcare costs would keep them from retiring in their early 60s. But in the end, they found good coverage was surprisingly affordable. By the way, if you want extra help planning a successful retirement, click on the first link in the description, and my team and I will take a look at your exact situation and help you come up with a game plan. Okay, so let's take a moment to recap. While health insurance can be a reason to keep working, it doesn't have to be. As I mentioned, I've been self-employed for 17 years, and buying health insurance is simply part of my budget. It's just another line item. If you leave your job, you often have the option to stay on your employer's plan through COBRA, Alternately, you could explore plans on healthcare.gov, where the marketplace offers various coverage options. Another choice is private insurance, which is the route I personally take. There are a number of options out there. You just need to find what works best for you. Purchasing health insurance from a private insurer can be as simple as contacting the company directly or working through an insurance broker. Brokers can be helpful because they collaborate with various insurance companies to find a plan that fits your needs and budget, potentially saving you time and effort. Take my client Susie, for example. She recently retired early and wasn't able to enroll in Medicare yet. She didn't want to go to the marketplace, so she worked with a broker who found a private plan that fit her needs, including coverage for her prescription medications and regular checkups. For Susie, it took the guesswork out of the process, and she felt more secure knowing a professional had done the comparison shopping. That's the role of the broker. Private insurance can offer more flexibility, but it's important to note that it may also come at a higher cost. According to the Kaiser Family Foundation, the average annual premium for employer-sponsored family health insurance was nearly $24,000 in 2023, and private plans often mirror these costs or go even higher, especially without the employer contributions. With the help of a broker, you may find competitive pricing and benefits that make private insurance a viable option if you're between jobs or self-employed or looking for a more personalized plan. Before I conclude this video, I'd like to share a few more considerations. Some people turn to a concept known as shared health. These programs pool together monthly contributions from members to share medical costs among the group. They're often faith-based and operate on a community model where members agree to help cover each other's medical expenses. So I Googled this topic. I came across One Share Health, a medical cost-sharing family that welcomes, invites, and unites those who agree with our core biblical principles relating to life, health, and caring for others. I haven't personally examined this option, nor am I suggesting it, but it is something, the concept of shared health, that I hear about from time to time. And lastly, when shopping for health insurance, you might consider a high deductible health plan that qualifies you for a health savings account. An HDHP means higher out-of-pocket costs, but lower premiums. With an HSA, you can save money for medical expenses not covered by insurance. Any unused funds stay in the account and can grow over time. HSAs, I hope you know this, have triple tax advantages. Contributions are tax deductible, earnings grow tax-free, and withdrawals for qualified medical expenses are tax-free as well. Unfortunately, once you enroll in Medicare, you can no longer contribute to an HSA, but you can still use the funds for these qualified medical expenses. Now that you understand exactly what no one tells you about healthcare and early retirement, that there are options, I want you to remember one thing. This information is crucial, but it's just the beginning. There's a lot more to consider when planning for your future. And the best way to do that is to have a team of professionals look at your retirement plan with our fiduciary-based securement review. So click the link below and let us guide you. I'll see you in the next video, and thanks for watching.